special shout out to your shirt. It's amazing.
Thank you, thank you, thank
Yes,
you.
Good morning, Nathan. Good morning to Nathan. Good morning, dear Nathan. Good morning to Nathan.
Hi there, I'm Sarah Kaplish, Chief Development Officer here at Lee Carlson Center. Thank you so much for being here at our virtual gala. We are so proud of the work that we have accomplished over the last 42 years, and particularly during 2020, a year like no other, for our organization and everyone around the world. We'd like to introduce Lee Carlson Center to those of you who are new and tell you about how we bring hope, healing, and help to our community.
Hey everybody, I'm Rob Edwards, the CEO at Lee Carlson Center. Let me give you a tour. At Lee Carlson Center, we've been around for over 40 years in the community, an agency started by members of the community that wanted a community-based organization that could really step up to the plate. So when folks first walk into the clinic, this is our area that we welcome them. They can wait for their appointment here. They get a chance to meet with our engagement specialist team at the front desk, let them know that they're here. what to expect when you come to Lee Carlson Center. It's a milieu of service where we can support your entire family, even multiple generations of your family. In fact, we do this, often have a child be referred to the program and then find out we can also support the parents or other siblings, grandparents too. And the exciting part is when you get engaged with Lee Carlson Center, we'll meet you right where you're at, our engagement specialist team, and we'll start building a relationship with you right away before you even start receiving services from a therapist. Come on down the hall here. Some wonderful art on the walls here. This is the art that our clients, our Bridgeview members are creating, and then they share it with us, which makes the color in here amazing. Here's our play therapy room. It was kind of fun. We partnered with a local bank to help kind of furnish this room, and our clients made this awesome sign here, thanks to Northeast Bank.
Dee, you were saying the chorus is your favorite part?
Mine too. I like the first part, sometimes in our lives.
Mm-hmm.
Not pain.
Well, because it's kind of acknowledging that, like, some happy songs are like, everything's great, nothing's a problem, everything's happy all the time.
Yeah, but it's
Like,
not.
no, not necessarily. So he kind of starts out with kind of acknowledging it, and then he's like, but it's not so bad if you have somebody else around you, right?
Sometimes there can be nothing worse than waiting for the mental health services you need today. And that's why at Lee Carlson Center, that's a primary focus of what we do. Our effort is to try to eliminate or reduce wait times in significant ways, so that when you reach out for support, which is a big deal to do, you'll be able to get connected to the support that you need right away. We even have a room set up just for telehealth therapy. So, it's a place where we're just interacting over a screen. So it's pretty simple. It takes away the barrier of access. One more reason why we can address mental health concerns in a preventative way before they become more complex issues.
The Lee Carlson Center for Mental Health and Wellbeing's mission since 1979 is to provide exceptional and affordable mental health services to families, children, youth, and adults in our community. We serve more than 7,000 clients annually through our vast range of services in home, clinic, and school settings. We provide innovative school-based mental health programs focused on early identification and ease of access for 65 schools across 8 school districts. We offer a sliding scale fee system and other financial assistance, which was used by 178% more clients from 2019 to 2020. We contributed $460,000 towards the cost of care for clients who were or underinsured in 2020. We forgave $250,000 in patient services last year alone.
The idea here is that, human beings, and sometimes we hit a rough patch. And the idea of Lee Carlson Center will come and will support you as you navigate that path, regardless of your age. Ages 2 to 92, you or someone you care about, your family, we really take that call, to heart, and the need to really deliver what people ultimately need, and that's a sense of hope.
Survey results show that 99% of clients felt that they were treated with dignity and respect by their clinician. 80% reported their child is doing a better job of managing their emotions since starting services. 88% said that they would refer a friend or family member to Lee Carlson Center. 82% felt that their clinician worked effectively with the cultural aspects of their situation. Amber Haley is the Director of Intensive Mental Health Services, including our Intensive Treatment and Foster Care Program, a trauma-informed and client-centered service for children and their families involved with foster care. She says, "It has been an honor and a privilege to work with our kids and families in the foster care system and to partner with county workers and school staff to wrap around and support our most traumatized children, to find healing and hope in their communities. The resiliency and strength of our clients possess is truly inspiring, It has made me so proud to watch my amazing dream team continue to grow into trauma experts that do not shy away from a challenge and really make client care a priority. I couldn't ask for a better team.
Hi, I'm Alex Joyce.
And I'm Samantha Ludke, and we're part of the Intensive Treatment and Foster Care Program.
We wanted to thank you for all of your past support and contributions and for helping us grow our program to service 6 different counties and to make us the largest ITFC program in the state with the most active clients and the most referrals.
And we would also like to ask for you to contribute and give a gift towards our goal of $50,000 to help continue to grow our program as well as other programs at Lee Carlson Center to help with clients that have limited access to insurance and other barriers to services. You can give at leecarlsoncenter.org/give.
Thank you. Bye.
We need to keep talking about mental health. And what we're trying to do with this gala, this virtual gala, is, put the light back on mental health concerns. We're seeing a lot of it pop up with COVID-19 and the outcomes of the pandemic. We know it's there. We know we have to tackle it and kind of address it. And that's what we do. That's our business. That's what we do at Lee Carlson Center, and we're as committed as ever to the community. The idea here is that we can all talk about mental health. We can all play a role in the lives of the people who are important to us in our lives. And that Lee Carlson Center is here as a resource. Please connect people you know to us. Please give us the chance to find a way to support you.
Katie Rudick runs our largest program, School Linked Mental Health, which places therapists in 65 schools across 8 districts in Anoka County and the North Metro. Here's what she has to say about Lee Carlson Center. I am abundantly grateful for the opportunity to be a part of a team of school-based mental health providers who contribute to the helping, healing, and lifting up of children and families in our community. Giving children a chance to improve their circumstances and gain skills, support, and insight that they need to overcome their struggles so that mental health challenges, victimization, and trauma do not become a life sentence is a priority for our team members. And I am so glad to be a part of it.
Odds are somebody you know is struggling right now. Someone at school, someone at work, someone in your home, maybe even you. Seeking support can be hard, but there is hope. At Lee Carlson Center, we have a team of professionals ready to help. Visit us at leecarlsoncenter.org or call 763-780-3036. Stay in touch with those you care about and check in often. This month and every month, keep talking about mental health.
The Lee Carlson Center's vision is to be the agency of choice, providing accessible, person-centered, and creative services, strategies, and solutions that promote mental wellness in our community while honoring the uniqueness and dignity of every individual. Katie Metcalf is the Director of Clinics and Domestic Abuse Programming at Lee Carlson. Here's what she has to say about her work. We are incredibly passionate about providing trauma-informed, client-focused care in all facets of our domestic abuse programming. We navigated our way through the changing world of COVID, providing telehealth services to clients in need throughout all of 2020. In the summer of 2021, we were able to come together again in person for groups while growing the program and number of clients served. We look forward to providing pivotal services for the community in the years to come.
I'll show you a little bit about a space that we have in the back. In our domestic violence programming, very important to kind of restoring the bonds that people have with one another. It's therapeutic. We've got a whiteboard that's very accessible. And we also have a drop-in center for adults experiencing severe persistent mental illness. The place is amazing. It's a place where folks can go 5 days a week, up to 6 hours a day of programming, get all the services they need to support their recovery, the maintenance of recovery. It really is about making sure that people are staying well. And that's emotionally, physically, got so many different innovative programs that they can drop right into. Healthy lunch in the middle of the day. But we've got support groups in the morning, offsite activities and socialization opportunities. I think the biggest thing about the drop-in center, which is so neat, is that people can visit there and connect with others who are experiencing the similar concerns. And that just makes so much of the difference. People don't have to think that they're the only one out there experiencing these emotional and kind of these mental health concerns. This is a place where you can come, you can feel safe, you can feel rest assured that there's going to be help here, both from your peers, people that are experiencing that just like you, and our staff.
One of our most beloved programs is at Bridgeview. Lee Carlson Center operates the Bridgeview Drop-In Center, Anoka County's only program serving adults with severe and persistent mental illness. The program offers therapeutic and enrichment services, including free transportation for Anoka County residents, writing and art activities, mental health education, offsite field trips, therapy groups, support groups, individual therapy, socialization, community resource navigation assistance, and free lunch. More than 90% of Bridgeview members report an increase in mental well-being from attending programs. We offer 25 classes each week to members, including yoga, dance, art, writers' workshops, and garden groups. Here's Brianne, a staff member at Bridgeview, talking about why the place is so meaningful to her.
Hi, my name is Brianne Halgrud. I am an intern here at Bridgeview, our drop-in center for adults with severe and persistent mental illness. And I just wanted to give you a bit more information about why Bridgeview is such an amazing place to support. Bridgeview is a center that is open to all adults struggling with mental health issues. It is a place that provides community, it's a place that provides love and kindness, and the generosity that is given between members is really just such an amazing, special thing. So thank you for your support.
Bridgeview is great because of all the activities and things they have here, all the groups, and the people, and the staff is amazing too.
Okay, put your right foot out, kind of let it hang out a little bit.
I am putting the right foot out.
It's also a great time to check out everyone's shoes.
Oh, don't look at mine.
Mama, yours, I think, are the classiest.
I'm Maria Davis. Welcome to Bridgeview. It is a drop-in center, but I don't feel like it's clinical. I feel like it's just a place to hang. There's many things to do here. There's different groups. Right here is the common area. We can play games or go up on tables to get our luncheon. They call us my tables. And then there's support groups, writing, music therapy. You'll love writing class. It's great. We do a lot of different writing, poems. We've done acrostic poems and we've done haikus, two of my favorite ones.
I don't like flowers.
And this is Mama Ethel.
I love my writing teacher.
And I love to write.
The thing I think that's so special about Bridgeview is that you can come there and you can be with people who are struggling with similar challenges. It's so therapeutic, so reaffirming, so supportive, and that's what makes Bridgeview special. Those folks that come and visit us at Bridgeview, we consider them members. These are individuals who have a membership in healing together.
Well, I used to cry all the time because my kids didn't take time with me. And I ended up going to the hospital for heart attacks, for depression. And I would just sit at home and cry. I live by myself. And then when I come here, I became mama. I got a family. Maria and Jill, all of them, they was right there when I had my surgery. I was not scared of it. They was there when I went in. They was there when I came out. I love all these kids here. They're my kids. That's the way I really feel about it. They're my children. I'm the mama, and I don't want nobody else to call me nothing but mama. Don't call me the F4. It's hard. I'm Mama F4. It saved my life, and I think it saved a whole lot of people's lives, not just mine. It saved a whole lot of people's lives. I've been here ever since. You know.
And we love the food. Yes, this place has saved my life many times. It's helped me Like when I've had memory lapses, like sometimes I get through PTSD, I have bad memory of flashbacks or memories, and sometimes my brain gets overworked. My husband describes it as a computer to control alt delete. The memories are still there. It just takes time to resurface or to warm. What's the computer word? I forget.
Load?
Load. Thank you. Well, unfortunately, people that don't have help or don't have a support system, like Bridgeview or anybody, they either end up in the hospital or they end up being by themselves, which is the worst thing to happen, or unfortunately, they lose their battle. And I do have a friend that he had lost his battle with depression and ended up committing suicide, and that was really hard on me. We all have some kind of mental illness, so we're like Mama Ethel said, we're like family. Oh, right here is the Rise room. Say hi.
Hi, how are you?
This is Lisa helps us for employment, helps us get jobs. You help out with resumes and cover letters, right?
Yep. We're considered with it's called the IPS program. So I help people that are ready to get back into the work field or just starting out the work field, and we work side by side to find an employment.
And this area is our quiet area. We can just chill or do puzzles. I would really highly recommend this place to anyone who has mental health challenges. And just to let you know, mental health does not define you. Your illness does not define you. Sometimes it can be an opening to things that you never knew existed within you. Like I didn't know I had any art ability. And here's some of our gallery. Well, with writing and with art, there's no wrong answer. Because it's how you feel. Like, sometimes it can have an ugly face, but at the end, you're making a beautiful painting.
It's a challenge.
Uh-oh.
Yes, it's very challenging. If you want to, put the words away. But if you are singing with the words, can you put it up a little bit? Because I notice sometimes when we read the words, then we kind of read to our own laugh. And you all have very beautiful voices, and I want to make sure that we can hear them. So, and it's okay to sing as loud as you possibly can, as long as you're listening to the people around you. You want to hear their voices too. Are we ready?
Yes.
Are we ready?
Yes.
Okay.
Yes.
Here we go.
Sometimes in our lives, we all have pain. We all have sorrow.
In 2020, with your support, we shifted our business model towards telehealth capability in less than 5 business days at the beginning of the pandemic. Adapted a drop-in center services to be virtual during the first COVID-19 lockdown, providing all levels of care we would have provided in non-pandemic times. Expanded school partnerships into private and charter schools. Tripled program enrollments in the intensive treatment and foster care program, and completed a professional process evaluation of the ITFC program with the Center for Advanced Studies in Child Welfare at the University of Minnesota. Susan Fullerton is the Chief Operating Officer of Leif Carlson Center. She manages day-to-day operations of our staff and agency and is so proud to work at Leif Carlson. She says, I have the privilege to work with a team of leaders who are client-focused. They show up each day supporting their teams so that they can support our clients. As you know, this is not easy work, but it is vital. Our team prioritizes their own well-being in a way that helps them continue to work towards the well-being of our clients. This cannot be undervalued and is key to our ongoing mission. Our team is exceptional at Leif Carlson Center, and we appreciate the opportunity to do this work with our clients.
Thank you so much for supporting our mission. As donors and supporters and people who will let others know that we're here, the work that you do in the community to support our mission is absolutely critical. We can't do this work without you, and especially times like these as we emerge from a pandemic, our community backing us up is so important. You know, we keep talking about mental health because that'll give people an idea that things can improve. There is hope.
Life is like a roller coaster with ups and downs. You have good moments and bad moments. Live life moment by moment. Don't give up. Things will get better soon. They always do. And you have touched so many people in your life, even if you smiled at a stranger. Be proud of what you accomplished in life. You have the world to see and so much more to accomplish. Remember, you're beautiful, and the world needs to see your beauty. It's the small things that keep us going. Most importantly, love yourself like you would love and respect your family, friends, or pets. I have PTSD, panic attacks, anxiety, dysthymia, memory lapses. Even writing this helps. After I wrote this, and every time I read this, I think, wow, I wrote this? I really need to follow my own advice.
Thank you so much again for joining us tonight. If you haven't already, be a part of our community of supporters by making a donation in any amount. You will receive a text on your phone with a link to make a gift. Any size contribution is dearly appreciated.
Sometimes in our lives, we all have pain, we all have sorrow, but if we are wise, we know that there's always tomorrow. Lean on me when you're not strong, I'll be your friend. I'll help you carry on, for it won't be long till I'm gonna need somebody to lean on. Please swallow your pride if I have things you need to borrow. No one can fill those of your needs that you won't let show. Lean on me when you're not strong. I'll be your friend. I'll help you carry on. For it won't be long till I'm gonna need somebody to lean on.
I think you should give yourself a round of applause. Bravo, bravo. Pound it all around.
Give yourself a pat on the back.
And you guys got